Welcome back to our channel, where today we're delving into a deeply important and increasingly prevalent issue, Alzheimer's disease. As our population ages, Alzheimer's is affecting more families worldwide than ever before. You've likely heard the term, but do you really know what it means? Alzheimer's is a progressive neurological disease that affects memory, cognition, and eventually, basic bodily functions. The disease accounts for an estimated 60 to 80% of dementia cases, a general term for cognitive decline severe enough to interfere with daily life. Now, let's talk about who is most vulnerable. While there are instances of early onset Alzheimer's, which can affect people as young as their 40s and 50s, the disease is predominantly diagnosed in individuals 65 and older. According to statistics, women are more likely to be diagnosed with Alzheimer's than men, partly because they generally live longer. And there's also a genetic component. Having a first-degree relative, like a parent or sibling, with Alzheimer's can increase your risk. You might wonder, how does Alzheimer's manifest? Early signs usually involve frequent forgetfulness, such as misplacing things or struggling with familiar tasks. Over time, the symptoms escalate to include mood swings, confusion, disorientation, and difficulty speaking or writing. It's essential to differentiate between typical age-related forgetfulness and signs of Alzheimer's. The former is usually a minor inconvenience. The latter disrupts daily life. Diagnosis is a multi-step process. There's no single test that can diagnose Alzheimer's, so healthcare providers rely on a series of evaluations. These can include mental status tests, a thorough medical history, neurological exams, and brain imaging scans like MRIs or PET scans. While these tests can't confirm Alzheimer's with 100% certainty, they can rule out other potential causes of symptoms, like vitamin deficiencies or thyroid issues. Now on to treatment. Unfortunately, as of now, there is no cure for Alzheimer's, but there are medications and therapeutic strategies that can help manage symptoms. Drugs like donepezil and memantine can regulate neurotransmitters to help improve cognition and slow down memory loss. However, their effectiveness can vary and may come with side effects. Therapeutic strategies like cognitive behavioral therapy and lifestyle changes, such as incorporating a heart-healthy diet and regular exercise, can also be beneficial. Additionally, maintaining a social life can help. Social engagement is linked to better cognitive function and a lower risk of dementia. Living with Alzheimer's, or caring for someone who has it, is incredibly challenging. The emotional toll is high, as patients may not recognize their loved ones or remember shared experiences. The physical burden of care can also be exhausting. Many families turn to professional caregiving services or specialized Alzheimer's care facilities for help. Support groups and counseling services can provide emotional relief and practical advice for both patients and caregivers. As for the future, what's on the horizon for Alzheimer's research? Current research is incredibly broad, spanning from genetic studies aiming to identify risk factors, to clinical trials testing new medications and interventions. One promising area is the study of biomarkers, biological signs of the disease that can be detected before symptoms appear. The identification of reliable biomarkers could make early intervention possible, which may delay or even prevent the onset of severe symptoms. Prevention is a less concrete subject when it comes to Alzheimer's. Some studies suggest that heart-healthy lifestyles can reduce the risk of developing Alzheimer's, but more research is needed. The Mediterranean diet, high in fruits, vegetables, and healthy fats like olive oil, has been linked to lower rates of Alzheimer's. Exercise, both physical and mental, also appears to have a protective effect. To conclude, Alzheimer's is a complex, multifaceted disease that impacts individuals and families in profound ways. It's a field of medicine that requires more research, greater public awareness, and increased funding for both care and cure. If you or someone you know is dealing with Alzheimer's, consult healthcare providers for a personalized treatment plan and consider reaching out to Alzheimer's organizations for support and resources. Thank you for taking the time to learn about Alzheimer's disease today. While we may not yet have a cure, knowledge and awareness are vital steps towards better treatments and ultimately, a future without this devastating disease. If you found this information valuable, please like this video, share it with others who may benefit from it, and subscribe for more health-related topics. Thank you, and take care.